Hello, I'm Janice Karin, Director of Policy, Technology, and Innovation at the Massachusetts Health Data Consortium, or MHDC. I run our Data Governance Collaborative, also known as the DGC. We start each of our weekly meetings with a series of industry quick updates to learn about new and proposed regulations, laws, standards, industry initiatives, and other activity. Join us for this week's updates. And if you'll go to the next slide, please. AHRQ has put out two reports. This is the first. It's on measuring burden in healthcare. Now, these reports are both what we would have called in my research days review articles, meaning that what they're actually doing is collecting all of the published research on a specific topic and analyzing it. So they did not do, this is not a new survey or data for a very small period of time. This is actually, in fact, if I remember correctly, this is looking at research that was published between 2010 and the beginning of 2010 and the end of 2023. So a pretty wide time window. And so what they were doing is looking at the ways that people are measuring provider burden and then highlighting some of the deficiencies of the research and some of the unknowns in hopes to both improve the research and use the existing research to find areas where they can also improve the actual burden issues. So they ended up identifying 11 measure categories for the documentation burden. I'm not going to read all of them. You can see them on the screen. Some of them are pretty obvious. Some of them are a little bit more interesting, like usability. That's a very difficult category to quantitatively measure. Most of the rest of these are things that can be quantitatively measured. So I thought that was pretty interesting. Any questions about these measures before we go on to some of what they pulled out of their research? All right, then let's go on to the next slide. So some of the stuff that they determined was that EHR usage logs were the most common source of data in all of the research. And it was very uncommon for folks to directly track the usage of EHRs or other tools. Most of the most represented group of the studies are clinicians in the US, particularly physicians and nurses. But it was global and it did look at a lot of different constituencies. There's very little evidence to prop up the validity of the measures or the appropriateness of the measures that were being looked at. And what was interesting is they went out of their way to say that the measures were developed and the research was done across a pretty wide range of settings, populations, and uses. One of their main conclusions was also that there needs to be more diversity of setting and population. So that to me was a little bit of a contradiction. Make of it what you will. And then the last thing they point out was that identifying measurement gaps is important to developing interventions. So you can find their full report at the link. It has not technically been published yet, but it will be soon. It's interesting in that I guess it's a step in the direction of trying to come up with a scientific way of looking at provider burden so you can track it and track improvements to it over time. But it's pretty clear that even though there's been a fair amount of research since 2010, that it's not necessarily particularly useful in setting a starting point, or really if we're doing anything beyond setting a starting point of knowing where we're at today. So any questions, comments, or thoughts there? All right, well, if you thought this one was depressing, let's go on to the next slide. This one's even worse. So they also put out a report on measuring primary healthcare spending. And the report is essentially, here are all the challenges of trying to do this. And we just we can't even come to any conclusions yet, basically, because there's just too much variance in the way people are defining things and categorizing things and trying to measure things. And that includes what is primary care. That includes what types of payers and patients and providers are included in the different research. it also includes what's considered healthcare spending more generally, because most of the measures of primary healthcare spending are a ratio, a percentage of the total healthcare spending. So the way that the total healthcare spending is calculated also makes a big difference. And as you can see, the ranges were from 3 to 10%. And they just basically said, there's no, analysis shows there's no way to analyze this data. So that was their conclusion. And which is not entirely shocking based on just common sense of the way we know the industry is right now. But obviously, this is an area that people are stressing, and it would be nice to have at minimum a baseline, but we didn't even reach a baseline with this. Any questions or comments or thoughts here? All right, then let's move on. So the last item this week is there was a piece of guidance put out that is actually international. It's being hosted by the government of Australia, but governments from all over the world participated in this, including from the US, CISA, the FBI, and the NSA. And it's basically a report on on safe use of AI. So it's basically guidance on how to use AI safely. And it has three major areas. AI basics, which is just a really brief explanation of the three most common types of AI. Challenges when engaging with AI, and then it goes into detail about each of the areas listed on the screen. And we can talk about any of them if you'd like, but and then the last one was mitigation considerations. This is just a partial list of what they include. They have a lot of really commonplace ones that everyone suggests, like, you know, basic security and privacy things, basic authentication things like using multi-factor authentication. But they also called out some things that maybe aren't on everyone else's list. And so they're still obvious, and sort of when you see them, you're like, duh, but they're not called out that often. And so I pulled out a few of those. Having an AI backup plan, what you should do when you think the AI is not helping or going wrong or isn't working. Understanding the limits and constraints of the AI system. That one we do talk about, but I don't think we can talk about it enough, because I feel like we can talk all we want about bias, about security issues, about bad data. All of that is true and important and things we should solve. But it seems to me like the absolute biggest danger right now is people who don't understand how AI works, you just blindly using AI and making bad assumptions about the results. This things like I think the biggest one, and we've talked about this before, is people have using AI tools that have a threshold set that says something like, if something is 80% likely to happen, we're going to return it as a yes. And so if someone is 80% likely to have cancer, you don't want to tell them they have cancer until what you want to do is you want to do a better test. You're screening them for the proper use of that AI tool is to do a much more detailed screening for the type of cancer that the tool thinks they likely have. And if you get back a yes, that can be misinterpreted as they have cancer. I mean, this is obviously a very basic example. It's much more complicated than this. But at the most basic level, I feel like this is a big danger. We don't talk about it enough. You know, I always ask about education of providers in particular in the healthcare setting. I feel like this is a big deal. And so I was really happy to see that called out in this report. And then the other things that were on the list, again, that aren't on everyone's list, were just really straightforward, like standard tech things, but that aren't necessarily things that people automatically think to apply to AI. Health checks, making sure that it's working properly on a regular basis, you know, pinging it and putting it through new samples. And then again, the backup plan, we kind of bookended it with similar things, having a plan when something goes wrong. And they do call them out separately because they do cover slightly different angles of sort of a similar topic. But in any case, I thought this report was really interesting. And I was really happy to see that while they did cover the same stuff that everyone else covers, they did talk about a lot more. And also the challenges were laid out really well. Again, those aren't really new things either, but they did a good job of laying them out fairly succinctly but very well. So I liked this paper, this guidance document, and I recommend taking a look at it if you have a chance. Anyone want to comment or have any questions or thoughts there? All right, then let's go ahead and go on, and if you'll pause on the next slide. I hope you learned a lot from our quick updates. If you're interested in finding out more about the DGC and its other activities, email me at dgc@mahealthdata.org. That email address is also on your screen.